So my name is Joseph Maura. I'm a registered community health nurse. I work as the nursing in charge in this facility. So basically most of the nursing activities, I'm the one who is sorting them out. The system is okay. At least now we're able to keep a soft copy of patients' records. We have been keeping hard copies of the records, and sometimes you may misplace the book, but at least right now you can go back to the clinical history for the patient by just checking throughout the system, and you can be able to tell what you managed, what are the lab tests that you did, what are the results, and what medication you used. And so you can be able to assess if the plan you gave worked or it didn't. Yeah. So it was not a bit of a challenge to work with a software, a health software, a health system that to manage patients. At least the paperwork has reduced. I'd say that I can save my pens right now. I'm not using a lot of them. Yeah. And at least most of the things that you discover, you can access them on the software, even at the comfort of your internet at home. The biggest advantage I've seen in Afya Pro, I'd say, is the Afya Mom part of it. The maternal obstetric monitoring tool and the application. I'd say that tool has really assisted in actually reducing my ANC clients' time, because if your patient is already on the system, I can see them as fast as I can, and later on I can be able to transfer that information in the registers that I require to transfer them into. That will also assist me at the end of the month in conducting my reports. So I'd say for anyone that would like to be introduced to this system, it's something that works. And it will help you in basically entering all the patient's data that you require that may sometimes be lost when you're using hard copies. Yeah.
Okay, I'm Francis Wambu. I'm a lab tech here in Tinganga dispensary. So for the system, I've been using it since early this year. That is on March. That's when I started using it in the lab. Yeah. The biggest advantage, yeah, I think the reporting, I think the work that you do, it captures everything, and then at least the report and that data for the system, it's very secure, because now there you have to log in, even now the confidentiality of the patient's results. Now the confidentiality is there, and then the data it's protected, not like the paperwork. It can just, you can miss them, they just disappear. But now for them, when they are there, at least they are secure.
I'm Moses Kihara, a clinical officer by profession, and I'm the clinical officer at the facility, and I've been in the facility for the last, I think, 3.5 years. Okay, initially there was some hardships, but at least right now we are at par and we're doing well with the system. At least everything is captured. I think initially we had other systems that we are using and were not giving us actually the quality we want, but at least most of the things have been captured in the Afya Pro system. It's been better compared to when we were manual, because initially we were manual, and at least it has been able to help us integrate plus the other systems that we have, because we don't only see patient in the Afya Pro system, we also have the Kenya EMR catering for the TB and the HIV. So at least their flow is been able to be captured, because sometimes we have to prescribe in the Afya Pro for the clients who are already in the Kenya EMR. Okay, the biggest advantage is that at least you have all the medical details of your patient, regardless of who saw them previously. Because when we started, we captured we were changing from manual to the electronic model. We were actually filling in the past medical history, so everything that was relevant medically to this patient is captured. So basically I have everything that concerns that patient, and I'm able to get to the same patient even if the patient is not physically at the facility. So follow-up is easier. The Afia Pro moms also doing quite well. We're able to monitor the antenatal mothers. Initially, they'll tell you the book got lost, but at least you have a medical record of the same, and you're able to have a good backup that you can look at.
Sister Donata Kilolo. I arrived here on 2nd March, and as I came in, the other sister handed me over, Sister Esther. There was already a plan for Afia Pro to be rolled out, and eventually the team came in for EMR, and we cooperated, and we've started from April, May to this date, and so far so good. The progress has been good, though initially slow, the network and some challenges, but every time we evaluated, recommendations were made and they always implemented. So we can see the difference, the change. We are almost at 70 or 80%, and the network is not a big problem now. On the other side, also it has helped with efficiency and effectiveness in the work, especially when it comes to quality on patient management. There are no many delays, and also we are able to trace the records, the paperwork. Sometimes the books, the cards get lost, but now we are able to keep the track of the patient's documents. I'll say the efficiency and effectiveness, and also on financial transparency. Yeah, at least like on weekly basis, I do ask if we print out, I will see in the system what has come in, and I can compare, contrast with what I get on cash, and it's good. It helps. Even today I did that. I was able to. The same with the drug management, the medicine. Yeah, we are able to keep the drugs in store and check the way they are moving, so that we don't get losses. And that helps for the growth of the hospital. Then you can tell what you have in store and what you don't have, and also the costs. So that transparency is very important. Then you don't fear very much, because everything is in the system, and when the drugs come, we receive them, we sign. Like if it's amoxicillin caps, I have 5,000. If they become 4,000, you're able to track the patients who received the drugs, and that's why they have come to that. Before, we could not track as such. We appreciate the support of Afia Pro, their cooperation. They have also assisted us to have a community health worker, a social worker, who is trying to link the health unit with the community, so that we can understand ourselves and they utilize the facility